हेलो, 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 हेलो। Mic test. Mic test. Mic test. Mic test.
Hello, hello. Can you hear me? No. How about now? Is that better? A little bit. Kendall, maybe a little more. Number 4. Can you hear me now? Yay! All right. How about this one? Good. Can you hear me? Linda, can you hear me? Linda. Alan, can you hear me? Alan Freeble, raise your hand if you can hear me. Okay, perfect. Hello. How's everybody doing? We got a good group today. I wonder why. It is good to be here. It is good to be here. Just to clarify, I am not performing any musical numbers, despite the setup up here that may give the impression that something musical was going to happen. I would never put you through such torture. As I said, it is good to be here. These are always good. These are always good days for me. I always enjoy the conversations that we have at these community chats. And I use the term enjoy somewhat loosely. But in all sincerity, I've been thinking a lot lately about this community, the Terraces of Los Gatos, and specifically about what it means to be a part of a community. And I think the Terraces of Los Gatos is a community and is not just a place where people live or just a place where people work. And I think that is sort of exemplified through the conversations that we have, and really the passion that residents have and team members alike to make this community the best place it could possibly be. Residents here at this community are invested in making this place the best place it could possibly be in every scenario. And what that does is that creates a lot of dialogue. And that dialogue is really, really productive. Sometimes it's difficult. Sometimes it's, I don't know, heated. It sounds so bad, but sometimes it's emotional. But I think that's a reflection of what this community is a place where everyone, we hope, is comfortable sharing their feedback. And hopefully we create an environment where, even if we can't necessarily do everything that everybody would like, we sincerely take that feedback and we listen to it, and we use it to try to help make the community the best it can be. On that note, we have received sort of a very early kind of a preliminary breakdown of the results from the recent resident experience survey. And so we will be getting on the calendar sometime early July. Date and time exactly still to be determined, in which we'll present in a formal way the results of the resident experience survey. We will not have by that point gone through the whole process of creating our action plans associated with the survey results. And so that will come at a later date, but we want to try to get those results out to the community as quickly as we can. So probably in about two to 3 weeks from now, we'll have something on the calendar that we'll do a formal presentation here, and then there'll be a sort of written or printed breakdown summary of the results that will be available for those that are interested. A couple of other things that I want to mention before we get on to bigger and better things. Okay, a couple of upcoming events. On June 27th, we have a slightly different and very special community currents event. And I don't know if Marion Shane, yes, Marion Shane is here. Can I pass the mic over to you to tell us a little bit about what makes this one a little more special?
Yeah, as has been said, this is a very different kind of thing than we had before. We're going to have Cooper Garrett that have a winery, and they have been in this area of the family for over 100 years and have a wonderful winery. They have an outdoor area where they have picnics and you can have wine. And we are going to have Cooper Garrett here. We're going to have Ruth Joan Garrett come out, and we will have wine tasting. Now, ordinarily it would run at least $20, but it is going to be free. And we'll have the round table set up. Paul will be out there. He's very excited about this and need to know how many are coming. So there will be a cutoff date, and make sure that if you want to come, that you sign up right away so that you will be included in this. And then also it'll be Zoom, but obviously those people will not have a chance to go ahead and have the wine. So it's going to be a fun and relaxing kind of thing, and certainly something that you will have a memory of in the future. Okay, the 27th, which is a Tuesday at 3:30 in the afternoon. Yeah, in June.
And the details will be included in the weekly updates tomorrow. And then I think the details will also be up on TLG Connect tomorrow, if not later today, with all the details and the link to sign up to participate. So thank you.
Yeah, I believe the sign up will start on the 20th.
Great, thank you very much. Okay, couple of other quick items that I don't want to miss. This afternoon at 3:30 today, Getting to Know You, Kate Brophy will be spending time with Bill Penrod, as well as, so Bill Penrod's our health services administrator who oversees all the operations up in the health center. And they will be joined by Parul Patel, who's one of our nurses, and she's our nurse educator up in the health center. Bill's been with us for a little over a year and a half almost now, and Parul's been with us for many, many, many more years than that. So it'll be a great event, again, this afternoon, 3:30 here in the GRA. And two other upcoming events, just to make sure everyone has on their radars. June 22nd, so a week from today, at 10 o'clock in the morning, we will have the opportunity to hear a virtual presentation from Eric Weinmeier. I think we talked about him last month, and we watched a brief video. For those that may have missed it, Eric is the first blind person to summit Mount Everest, as well as all of the other 7 highest peaks on all the continents, and a whole lot of other really remarkable things. A really inspirational person. And we are fortunate enough to have a human good connection with him. He is a family member of a resident in one of our human good communities back east in Pennsylvania. And so we were able to make that connection, and we'll have the opportunity to hear him speak. It will be online. We'll be showing it here in the GRA. So if you want to come here to the GRA to watch it, again, 10 o'clock next Thursday, or you can log in online, and the link is available on TLG Connect. Questions?
I noticed that it's going to be 3 hours. And is the whole, do we have to stay the whole 3 hours, or is it a presentation? We have to see the whole thing.
Good, very good question. And don't worry, it's not actually 3 hours. But there was some information that was published that was slightly confusing. That said 10 o'clock to 1 o'clock, but it was, anyways, it's 1 o'clock Eastern time for those that are joining on the East Coast. So there was some confusion there, and hopefully we've corrected it on the posting, but it's an hour long. So 10 o'clock to 11 o'clock. You're welcome. Oh, Ms. Dawn. Okay. Oh, this is good. All right. We'll go here and then and back. Oh, yeah.
Unfortunately, I'll be on the airplane on the 22nd. Is it available online or something later on?
It's a good question. I don't know, but I can find out and we can publish that information. So, okay, we'll find out if it'll be available at a different time, if it's being recorded and made available, and we'll share that information. Yeah, I'm not sure. I think Christy in the back, Ms. Doms had a comment or question.
I just wanted to remind everybody that next Wednesday, we have 6 open residents for anybody who would like to see them. There'll be an alcove, a 1-bedroom, 2 2-bedrooms, a patio home, and also an assisted living suite. So come out and support us, okay? So that's next Wednesday. Excuse me, 2 to 4.
2 to 4. And so thank you for coordinating that. That I think is fantastic. If the residents that want to participate, do the residents just go to those individual apartments, or is there a central meeting location to then go off to see the different apartments?
On Cubicle right now, you'll see that there's a sign up if you'd like to go. What we're going to do is put in each elevator, there will be the flyer. Omar's making out the flyers that'll be posted around too, but there'll also be a map, and highlighted on the map will be, thanks to Bob Sturdivant, by the way, who helped me with that. The highlighted on the map will be in green, will be the actual apartment that will be shown. They're going to be grouped pretty much, except for assisted living here and the patio home, but the other 4 in the PQ building. So they're real close together.
Thank you very much. Also on the 22nd, a week from today in the afternoon, we are excited to have the 24th annual Seniors of Distinction event. And I always kind of feel weird when I say the 24th annual, because the first one was 27 years ago, but we skipped a couple of years because of COVID. So it's the 24th annual, even though the first one was 27 years ago. But this is really a great event. And this is an event that is put together by the Community Advisory Board. And it's an event every year, except for the past 2 years, where the advisory board works with the community at large and many of the volunteer organizations to recognize, honor, and celebrate the volunteerism of older adults throughout the greater Los Gatos and Montsereno areas. So there are 8 different clubs and organizations, each of which have one honoree that will be awarded the Senior of Distinction Award for the great work that they do within the various organizations and clubs from which in which they participate. One of those organizations and clubs is the Terraces of Los Gatos. And so we are pleased, and I don't think it's a secret, right? Oh, okay. So I am pleased.
Please announce it.
I am pleased to announce that this year's honoree from the Terraces of Los Gatos is Pat Smith. Oh, there's Pat. Do you want to stand up and wave your arms around so we can all see you and clap again? I thank you for all that you do for the Terraces of Los Gatos and the greater community. Pat is, as I'm sure all of you are aware, is a very, very special individual who has done and continues to do a tremendous amount of wonderful work to support the community. So, Linda, Christy's coming up behind you.
So an award like this goes for things that people have done over a period of time. And the time where Pat made the most impact, which is hard to say because she's always making an impact around here, was when we had COVID and we had nothing else going on. But Pat insisted we kept on producing the rag. We would keep writing. We would keep putting out a rag every month, whether there was anything going on or not. And it was the one thing we all could look forward to. And it was due to Pat and her drive to get it done.
Thank you, Linda, for those comments. So for the event itself will take place here in the GRA. There will be, because this is an event that we're partnering with the greater community, we're gonna have a full house. So there will be attendees, first the people that are receiving the awards, but then each of those award recipients have guests that they will be bringing as well. We have the mayors of Los Gatos and Montesrina that will be here as well. So the GRA will be set up like this, although we will have a lot more chairs. Will be full capacity here in the GRA. There will be a limited number of seats available for residents of the Terraces of Los Gatos as well. We don't know how many yet because we're still working on the attendee list for the guests that will be coming. What we are doing, though, to make sure that there is an opportunity for all residents to be able to participate is that it will be streamed on TLG TV on channel 998. It will also be available to join through the activities cube, and then we'll also be playing it in the lodge dining room as well. So there'll be various places within the community or within your own homes where you can watch it if there aren't enough seats for you here in the GRA. Couple of other quick items. Let's see, where should I go next? Aerial upgrade. So the aerial system, we are moving along with the plans. With the progress is we're making progress with the aerial upgrade. For those who may not be aware, the aerial system is the system of motion sensors within residential living resident apartments, and then it's also the pole cords and the pendants throughout the community. We are upgrading that system. The look of the system, the look of the devices is nearly identical to what we currently have. Really what's being upgraded is the meat behind the system. It is, the upgrade will increase the sort of reliability of the system. It will also allow us to be able to troubleshoot the system more effectively and efficiently if there are ever any problems with it. And perhaps most importantly, it will allow the system to continue to function for a significantly extended period of time during power outages. So that system is in the process of being completely replaced. It will take about 2 to 3 weeks, I think, total. But we're pacing right on schedule.
a question. I read it and it says, as you said, it will be working for some days at the power outage, but all the units in the rooms or apartments is battery driven. The one I have sitting, it's a 5 years battery at present, or
Oh.
it might be dead.
Yes, and so it's the, and I forgive my lack of technical knowledge, but it's this. So you're right. The pendants themselves are on battery, but then the mechanism that receives that information is the battery backup life of that system that receives and transmits the information is being upgraded. Yes, Joanne Wilson.
Can you translate in plain language the letter we received regarding all of this responsibility and the finding of lack of responsibility, et cetera, et cetera? You know what I'm talking about? You look blank.
Okay. Oh, okay. So, yes. So you received a letter, I think from Sandy Mirsal, that as we were sort of taking the opportunity as we're replacing the system to essentially let everybody know what the system is and what our internal operations are, how we sort of utilize that system. And so there aren't any changes from what we've been doing currently. The letter was really just kind of a refresher and a reminder, and letting everybody who may not know how we utilize that system. And so essentially the way that works is every day at, I think 10:30, 12:30, every day at 12:30, the concierge runs a report that shows all of the apartments in residential living that have not had their motion sensor triggered. And so once that information, that report is received, then there's a process for the concierge team in collaboration with other departments, the wellness department primarily as needed, to check on those residents and make sure that the residents are doing okay. Really, the purpose of that system is to ensure that no residents have had an accident. Maybe they've fallen and they're on the floor in their apartment, and so they don't go an extended period of time without anybody checking in on them if they haven't used their pendant.
All right, so it's essentially going to be a team member responsibility, because it sounds as if we have to have a buddy system or something on our mailboxes to indicate that we are alive and will.
Yes, you can.
You bet it was confusing. It wasn't Sandy's letter that was confusing. It was a letter from corporate that went on and on and on. And I thought, they must be replacing the buddy program. I don't know what they're talking about. And then I got to Sandy's letter, and then it became clear that it was really all about the current mechanism. And the buddy program is still in place. And the reason we put it in place was because it is so late in the day when the concierge or people at the terraces know anything has happened out in independent living, so that we have people checking on each other to be sure we're all up and okay long before the terraces gets to it. So yeah, it was confusing, especially with the letter from corporate.
Yeah, thank you for clarifying. So along with the letter was the official Human Good corporate policy and procedure about that whole system, which, yeah, is super confusing. So you can just disregard. I mean, it was provided sort of for informational purposes, and I can certainly understand how it would be confusing. The short of it is nothing is changing from what we're currently doing. David.
So why don't we just have somebody check early in the day? I mean, that's not rocket science. Check about 8 o'clock in the morning or something.
Yeah, no, that's a good question. And finding that sweet spot of what the best time is certainly a challenge. Because some people are certainly still in bed by at 8 o'clock or sometimes later.
I was glad to see that it is a requirement and that if anybody wants to opt out, they have to make arrangements with you, because we did have somebody who opted out and did not make other arrangements, and the result was not good.
Thank you. Yes, Patty.
Where to place this motion sensor was really thinking, because I discovered my ARIA sign right beside my toilet. And first thing in the morning, that would be the first thing I would do in the morning. So I think that they're going to be very effective.
Thank you. And just so everyone is aware, they're motion sensors. They're not cameras or anything like that. So it just triggers based on movement or lack thereof. Christy.
No, I was just going to say, since Sandy's not here, continue to make sure that you do your absence reporting, because that's one of the things that the concierge will check, is if anybody's in the hospital, in the health center, or if they're off campus. So continue to let the concierge know if you're leaving, and that way that's helpful when they're looking at the sensor report.
Thank you for that important reminder, Christy. I wanted to also just let everyone know we finished the remodel of the team member break room, which has been a long time coming. I know that doesn't directly impact the residents, but I'm sure it indirectly does, because it gives our team members a more comfortable place to take their breaks throughout the day. And so we're happy that that was done. We appreciate your patience if there was, more team members that were maybe taking their lunch breaks in areas where typically they wouldn't while that construction was going on. We are also going to be starting the remodel of the team member restrooms back near the team member break room. There's also restrooms for team members. That renovation will start next week. And so just like you may have seen team members taking their breaks in areas where they typically don't take their breaks, if you see an influx of team members using restrooms that typically they may not use as much, that is the reason why. So we appreciate in advance your patience and understanding. We're really excited for that work to get done to benefit the team members. Also, on the subject of restrooms, the pool restroom remodel is complete, and we are making good progress on the plans for the Galleria remodel. I had the opportunity to meet with the decor committee earlier this week and review the current plans, and it was a good discussion. I don't know if anyone from the decor committee is, yes, I see a couple of people. It was a really good discussion. We got some really good notes that we got from that conversation. And we have, just for those that may have been in that meeting, we've already been in contact with the designers and the architects about some minor modifications to the plans based on that feedback. So we are still on track with the goal to submit plans to the town of Los Gatos in July. And we will have more plans that we can share sort of more publicly around that time as well. So we're moving ahead. Things are moving in a very good direction. We have also completed, and maybe I put completed in quotes because there's some work that needs to still be done and some work that needs to be redone on the signage project. So I guess the initial workload has been done. Vincent and I are scheduled to meet tomorrow morning to do a thorough community walkthrough to identify some of the areas that need to be changed, need to be sort of fixed. One of the most significant things is, I don't know if it seems almost like we've created an eye check, a vision test for the letters on the buildings outside. So we went from relatively large letters that were relatively easy to read to much smaller letters that were much more difficult to read. So that's one of the items that we are working on a plan to correct. If you do have any feedback, or if you notice that there's some signs that, there are a few team members that came into work and they're like, oh, I guess I got a new office because the sign says somebody else's name on it. That kind of a thing. If you see any things like that, or if you have any sort of general feedback, filter all of those things to Vincent, please. He's sort of putting together a list of everything that needs to be done, sort of to finish that project. I also, yes, Ms. Pinkston.
Thank you. Could you please give us some background on the changing of all these signs? Is this new planning, new ordinances that we had to cooperate with, or what, how did this all come about, and what is the cost for all of this changing of signs?
All very good questions, and I will answer them to the best of my ability based on the knowledge that I have. The planning of this actually started about 3 years ago, working with Tyler Eachian, our previous vice president of operations, as well as we were working with the art department at Human Good. There's a couple of reasons why we wanted to do it. One, a lot of the signs throughout the community were outdated. They were wrong. We've made additions to the community that weren't reflected in the signage. And so the maps outside, I think they didn't have the fitness center. And I don't think they all had the Grove and the S building, which were the most recent additions to the community. So that was one of the reasons that prompted the need to replace all of the signage. A lot of the signage as well, even though it may not have been outdated, was very, very worn. Some of the things that stick out to me most are a lot of the outdoor signs. The sign at the spring court and the other courts were weathered and faded and needed to be replaced. And so there was a decision made that not only at this community, but eventually at all of the Human Good communities, we would be updating the signage, would also bring all of the signage up to the current code requirements. There were a lot of signs that were not meeting the current codes in terms of visibility. There's very stringent codes about color contrasts on signs, heights of signs, and the specific information that's included in some of the signs. And so as we sort of started going through it, we realized that there was really a lot more to this than needed to, that we needed to address. And so we went through a very, very long process, literally working through thousands of signs to make sure that they were all perfect, and then they're installed. And cost goes, to be perfectly honest, I don't know what the dollar amount is, and because the funding for it didn't come from the community, didn't come from even our own capital improvement budget, it came from there was a very large refinancing of the organization that was done several years ago, which generated an influx of capital that was specifically sort of designated for capital improvement projects throughout all of the different communities. So this was one of the projects that fell under the list of items to be done with the refinancing capital.
For the last dozen years or more, there have been feedback to the community, to Vincent or whoever occupied that chair, that there didn't seem to be any P building anywhere. There is still no P building. And in fact, we have a sign that specifically says, go this way for Q, R, and parking. There is no place that indicates there are residents in the P building.
Yeah.
People can't find it. This is not rocket science. I didn't think. And so we spent years and years working on this and nobody thought of that.
Yeah, so somebody else had mentioned about the P building yesterday. And so, yeah, it looks like we need to look at that a little bit closer, which we will. And then also the letters, you're right, that the letters on the outside of the building need to be changed. So we'll work on a plan to do that.
Well, I've already told you this, but I wonder why the independent living residents apartment numbers had to be changed. Those were very attractive. The new ones are motel grade.
Thank you for the feedback. Okay, let's move on to another topic. Was there a question or comment over? Yes, a couple over here. Jim, can you say that one more time in the microphone so we can all hear?
Yeah, on the new campus maps, I do not see the elevators located.
Ooh. Okay, we'll take a look at that. Thank you for mentioning that.
There is it's a very attractive sign as you go into the building by the M elevator on the first floor. And it is the one place that people who are visiting, who are looking for the poor people who live in the P building, and I'm one of them. And you look at that map, and that would be the perfect place to indicate that the P building, but all it says is parking, and you have no idea on the second and third floor, there are people who actually live there.
So can I share a story?
Certainly.
So I've been here at the community for 7 years, 6 years, 6 or 7 years, somewhere in there. And when I had was relatively new in the role of executive director, I was walking home I wasn't walking home. I was walking out to my car at the end of the day, and I was walking along the Esplanade, and there were a couple of people out on the Esplanade, and they were sort of looking around, and it was clear that they were probably visitors looking for somewhere to go. And so I was like, oh, I'm going to help these people. And so I said, oh, can I help you find something? And they said, yeah, well, we're looking for the P building. And at that moment, sort of as I was asking, I realized I don't know where all the buildings are. And admittedly, I still struggle sometimes of remembering the exact locations of each of the buildings. And so they told me, or I said, oh, okay. And I was trying to think quickly on my feet. And I said, oh, well, you know what? There's actually a map right over here. Let's look at it together. And then you can see on the map where it is. So then you'll always know where it is. And they looked at me and they said, oh, I'm sorry. I thought you worked here. And I was like, oh, man. And so for a split second, I thought, okay, maybe I just go like, oh, yeah, I'm just visiting too. And then I thought, no, then they're going to see me again. I don't want to say that. So I said, oh, no, actually, I work here. And oh, okay. And then they kind of looked at me like, well, then why the heck do you don't know? And then they said, oh, well, what do you do here? And again, trying to think quickly on my feet, I'm like, how do I say I'm the executive director and I don't know where the heck the buildings are? And so I said, oh yeah, I work back in the offices and they don't let me out very much. So I don't get out very much. And they're like, oh, okay, well, thanks for your help. And then they went and looked at the map and then they figured it out. And now that you mention it, I don't know if they ever actually figured it out because they probably ended up in the parking lot. Anyways, thank you. We will look into see how we can address the, it's sort of like P building is kind of like Area 51, or it's not really there, but we all know it's there.
Bradley, I wondered if all of these changes, including our apartment number designs, is to try to change the marketing in all of the facilities to be one thing instead of the terraces being distinct with all of our arches. Our name tags, our door tags had the arches, everything else had the arches. And I noticed in the things that are being done now, the arch is going. And is that to make it all generic so that terraces of Los Gatos and terraces of Los Altos look the same, or their marketing looks the same?
It's a good question. And I think there is not a desire to make everything the same. I think there's a desire to, throughout all of the communities, or at least the communities that may need it, refresh some of the look and refresh some of the appearance of the communities. And also there is a sort of marketing component to it because we want to make sure the community is updated and appealing to potential residents that move in the future. But I think that the question and the feedback that's sort of related to that question is heard, that we need to make an effort to make sure that we keep the individual identity of all of the communities. So I will make sure that sort of as we, and actually on the subject of arches, that's one of the things that came up during the meeting with the decor committee. And so we'll take that into consideration as there are other work that's done throughout the community. Bob?
This is fait accompli, but I was frustrated to read that Reach from Infinity is being replaced as our physical therapy source. Sandy, over the past couple of weeks, has gotten referrals from 2 physicians for physical therapy, and physical therapy is leaving in 2 weeks. Last time physical therapy was replaced took 3 months before it was fully staffed. And all I can say is I'm frustrated, and we may end up going outside and driving up and down National Avenue. I don't know.
I share your frustration, probably from a slightly different angle. What Bob is referring to is we have made the somewhat difficult decision to part ways with our current therapy provider. So physical therapy, occupational therapy, and speech therapy that's provided here at the Terraces of Los Gatos, both for those in the health center as well as on an outpatient basis for the rest of the community, is all contracted out through a third-party provider that we work with. Just over a year ago, we made the decision to go with a new partner. The level of services, most specifically the staffing levels of the previous provider, were not meeting the needs of the community. And so we went through the long process to decide that we were going to change partners and work with a new therapy provider. We came up to the 1-year mark with the new provider, which is Infinity. And to be perfectly frank, we found ourselves in a similar situation that we were at 1 year ago with our previous provider. And so we ultimately decided to make a change once again, because we were not able to resolve the issues, primarily staffing related issues with the current providers. We've done something a little bit different with our contract with the new provider, something that we haven't done before, And as far as I'm aware of any other communities haven't done before, we built into the contract incentives for the new therapy provider that are based upon staffing levels, and not only staffing levels, but based upon permanent staff. What we found is with the previous two providers, we'd gotten to the point where nearly all of the therapists were traveling therapists, temporary therapists, where they would come in for a week and then they'd leave, and then we'd have another therapist that comes in. And doing that on a regular basis really hurts the ability to have strong systems that are able to serve the residents well. And so we had to make a change because we weren't making the progress that we needed with Infinity. But like I said, we built in to the contract with the new provider that will coming in some assurances about not only staffing levels, but the percentage of staff that are permanent here at the Terraces of Los Gatos as opposed to traveling therapists. We are hopeful and confident that that will allow us to make the improvements that we need to better serve all of you and the residents up in the health center. And it's something that we'll be monitoring very, very closely to make sure that we see the improvement that we need to. We have one comment.
So there
here.
was the circle back with the sign question.
No, we are done talking about signs. Sorry, no, just kidding.
Yes, these are 30 years old buildings. And the signs are really perfect on these new box houses down at Lark and Los Gatos Boulevard, but they do not fit with the architecture here. And how long do you think those white signs in the light of the sun and so on will be white?
Thank you for those comments. Linda.
Picking at the same sore. If I were marketing, I would say, I really don't like it if you go around and pry hundreds of signs off of walls and leave eyesores for us to show all of our potential, future residents, as some place they'd like to live. Ideally, you would have done something in and around painting at the same time. So I don't understand this hit and miss, do this little dab now and then patch up. It's just never going to look good. And so what, if anything, is the plan to address it as a whole?
Yeah. So this is a good comment. And actually, as we sort of were leading up to this, we had quite a bit of conversation about this issue. We had discussed the option to sort of repair and patch as we go. We didn't do that for a number of reasons. The most significant one is that it would have, logistically, it would have meant that signage was down and there was no signage, where one, sort of operationally, we have to have signage, and two, from a regulatory standpoint, we have to have the signage. And so what we will be doing is obviously going around to all of the locations and repairing and patching as needed. It will be a long process, to be honest. But we decided it's best to get all of the signage up and then go back after the fact. Was that the right decision? I don't know, maybe not. But that's the plan moving forward.
When you patch and repair what just recently happened, could you please patch and repair where they changed the lights, the light fixtures from those triangular light fixtures to the rectangular ones? Because I looked out at a column, unpatched, unpainted, and really dirty.
I will make sure that we include that in the plan as we go with the repairs behind the signs.
Back to physical therapy. I may have missed something, but what is the connection with Kaiser now and physical therapy?
There is Kaiser, there are no changes to ability to provide therapy for Kaiser patients. Kaiser has their specific therapy clinics that they
I thought there was something in the hopper to remedy that a while back.
there is not at the moment. So those that have Kaiser need to receive physical therapy from the clinics that Kaiser operates. They can receive physical therapy or occupational therapy here, but Kaiser won't cover it, unfortunately. So it'd be out of pocket. So we'll go here and then we'll come back over here and then we'll.
Yes, I'm going to be talking about physical therapy. When is the change going to be made?
The change will be effective 1st of July.
Okay, are we going to have people then in on the 1st of July so that our therapy will be continued?
Yes. Yeah.
Okay.
So all of the existing therapy programs that are in place will continue. And then the goal is that shortly thereafter, we will be able to serve even more residents than we're currently able to serve. So those that are currently receiving therapy will continue on starting July 1st, but with the new company. The reality is too, some of the existing therapists that are working here will continue to work here. They'll just be getting their paychecks from a different company. So the goal is the therapists that are here, that are permanent, that we like. The plan is to get them hired and onboarded with the new company so that the therapists will continue to work here.
Is the director staying
To be determined.
to be determined? Well, I'm going to be in the health center on the 14th of July because I have a knee replacement and I want to make sure that I'm going to get good physical therapy. So that's why I'm asking. And if I don't get good therapy, I'll be at your desk.
I'll be ready, but hopefully you won't need to.
So I'll do Mr. Sturdivant.
Okay, we got 2 more comments and then we got to move on.
You want to do her and then I'll.
We'll start with Bob and then we'll.
Oh, well, I just want to correct, I think what you said. We've had Kaiser for a long, long time. They are now contracting out to an outside firm that brings the therapy to our apartment. And it's been excellent. This is our contracts have been the last 3 months or so. And we've had sometimes 2, sometimes 3 therapists coming in. They're always the same people. So they know what we want, what we need and that sort of thing. So it's been excellent. So Kaiser's really changed their mechanisms.
Thank you for mentioning that. And just to maybe put a finer point on that, there are outpatient therapy providers and there are in-home therapy providers. And so Kaiser has an in-home therapy program where yes, they'll send therapists to those that meet the eligibility criteria. Slightly varies if you're eligible for in-home therapy versus outpatient therapy. So outpatient therapy, we aren't able to provide, but those that are eligible for inpatient or in-home therapy through Kaiser, they can be provided. Thank you for making that clarification. Angela Papanassos.
I wanted to bring up another subject. Sometimes when I go upstairs to the health center, or I'll go up to the conference room using those stairwells that really look nice with that padding or whatever it is that they use on the stairs. If anybody uses the end of the building stairwells or the middle of the building by the swimming pool, those stairwells are dirty looking. It's cement and it just, the strips that are on the end of the stairs are tearing off and they're not well maintained at all. And I'm just wondering if we could have that same type of flooring that they have on the inside on the other stairwells. Easier to clean. They
Yeah.
look easier to maintain.
Okay. We can look at adding that to our plan at some point. Okay, last comment or
Okay.
question.
Back to health. I have Aetna and they have my Medicare, and there seem to be some problems along that line because physical therapy wanted Medicare in order to, for me to be there. And I'm wondering, can we work this out? Because Aetna was more than willing to pay. There was no problem. And I don't know whether the problem was terraces or whether it was the physical therapy.
Okay. Yeah, I don't know the specifics for that case. When there are insurance providers outside of the traditional Medicare programs, oftentimes or usually always they require a pre-authorization process. So there may have been a hang up somewhere in there. But if you remind me to check on that, I'll look into that specific case for you. All right, it's Flo. What last one?
It has come to my attention that there may be a new policy that's come down from Human Good about inclusion, and that is impacting some of our activities. And I'm wondering if you could inform us about that.
I don't know of any specific Human Good policies on the subject.
That's what some people were told on Tuesday when there was the men's luncheon. Am I refreshing your memory?
Yeah, well, this is a tricky one. May I table this discussion for another time? Because I think it's an important discussion that we have to have. But time doesn't permit because we have something very important that we have to do within the next few minutes. I always get confused because I look at the clock and I think 2:30, but it's 2:15 actually. That is the hour mark. We have, for the last year and a half or so, we have had the opportunity to have somebody at our community that has enriched and elevated the experience for the community as a whole and really made a deeply profound impact on so many of us on an individual basis. And as we previously announced, today is Cindy McCalmont's last day here at the Terraces of Los Gatos. When we made the decision to create a slightly new position of spiritual care director, we've historically had a chaplain, and we made the decision that we were going to continue to have somebody in that role, but we were going to look at it from a slightly different lens, through a slightly different lens as a spiritual care director. We didn't really know what that meant, to be perfectly honest. I think we sort of had a vision or a theoretical vision of what it was, but we didn't really know. And we met Cindy, and we knew that Cindy was going to be the one that would help us figure out what the heck that meant. And she did that far beyond what we all would have, could have, did, and could have anticipated. Cindy is moving to the East Coast. And we are absolutely devastated, but we're also very, very excited. And more than anything, we are just simply deeply appreciative of the impact that Cindy's made on this community, and that will forever be a part of this community. I'm gonna maybe ask Cindy to come up in just a minute. But before I do that, I'm gonna ask Shell to come up. Shell has prepared something for us. All right, Cindy, come on up too. And I'll pass the mic over to Shell, and yeah, I'll stop talking.
My friend. I've been privileged to be on the spiritual care committee with Cindy for this last year and a half. You want it this way? Can you hear me now? Closer. I can't eat it. It's not an ice cream cone. So I have enjoyed my time with Cindy and with the Wheatons and with Kate Brophy very much. Cindy has always been so inclusive. And I said when I found out that our care director was leaving, the Torah portion in my Jewish tradition was Naso, which is from Numbers, and it included the priestly benediction. So God provided Moses with instructions on how Aaron and his sons, the priests, should bless the Israelites. So from this portion, I have the power to offer you, who have given so much to us, the blessing from Numbers, which is, may the Eternal bless you and protect you. May the Eternal make God's face shine upon you and be gracious to you. May the Eternal's face be lifted towards you in favor and grant you peace. Thus they shall link my name with the people of Israel, and I will bless them. In Jewish tradition, I am offering a traveler's prayer to Filat Haderech on behalf of the Terraces community, which you have served well with caring, passion, and compassion. We love you. And this was composed by Debbie Friedman of blessed memory. I hope I can get through this. May you be blessed as you go on your way. May you be guided in peace. May you be blessed with health and joy. May this be our blessing. Amen. May you be sheltered by the wings of peace. May you be kept in safety and in love. May grace and compassion find their way to every soul. May this be our blessing. Amen. If you would like to have this, you may.
I can't say anything after that, other than I think I can confidently speak on behalf of everyone at the Terraces of Los Gatos, that Cindy, you will be truly missed. And we truly are grateful for everything you've done for this community. We're out of time. Cindy's going to stick around for a few minutes. If you'd like to spend some time with her. As I said today, it will be her last day here at the community. Are there any parting words that anyone would like to share to the group before we officially close the meeting? Mickey.
I would just like to say that Cindy has been such an inspiration to so many people, and either religions, whichever religion one belongs to, she's understood. And it's been a pretty unique experience at the Terraces. So we appreciate you, sweetheart.
Hi, everyone. So when I first started working here, I was going through the loss of my mom. And I never really talked about it because, you know, we really don't know how to put things like that into words. But I heard a lot of good things about Cindy. So I went to go speak to her one day, and she gave me some books about grief. And whenever I needed someone to talk to, she had the empathy towards that type of situation. and it really helped me. And then for Mother's Day, she put together like a little Mother's Day celebration. So everyone that had lost their mom was able to read a speech about their mother. So that to me was, it was really sentimental and it meant a lot. So thank you so much, Cindy.
The thing that I noticed about Cindy is that she could talk with you. She would look inside of you. She could see your spirit. And she would, she would mesh with your spirit. I'm sorry to be so emotional, but she's just such an extraordinary human being. We just have to say goodbye and bless you and find other communities that you can do the same thing.
Cindy, is there anything that you want to say to the group? No? Okay. Cindy will be here around though.
I don't know whether you realize that Cindy has been going to be driving across the country alone for the next 3 or 4 days. And we want her to know that our spirit of love will accompany her during that long, lonely drive.
Cindy could have stayed in her office very easily and done whatever needed to be done or not needed to be done, but she traveled. She made a point of meeting people, making herself highly accessible to those who needed her and even those who didn't. And I think we're going to be really missing seeing her face where she comes around and has that wonderful background in mental health, and even mentioned that she had had some problems along that line. She's been very open with us, and that has made a difference.
Just to net it out, Cindy is irreplaceable. We'll never have another Cindy, but we'll always remember the one we've had.
Amen. Thank you all for being here. And thank you, Cindy, for being here. We will close the meeting officially. But as I mentioned, Cindy is going to be sticking around for a few minutes if you'd like to share any words with her. Thank you all. Have a good afternoon.
What was that? Oh, yeah.